All right, so Haley Wheelock, MPH, is a founding member of the Save Lives Oregon leadership team, providing instrumental guidance and support in Oregon's responses to the overdose crisis. As a supervisor of Outside In's drug user health service program, Haven helps people who use drugs minimize their risk for overdose and infectious disease. Haven was the first in her family to earn a college degree and has been working in harm reduction for more than 14 years. Welcome, Haven.
I think it's funny that bio said 14 years because I'm coming up on 20 here at this point. But hi, everyone. My name is Haven. I run the harm reduction program at Outside In here in Portland, Oregon. Our name will be changing here in the hot minute, but I'm not exactly sure what it's changing to. So that's just how it's going. I was asked to come in and speak a little bit, and I apologize to anyone who saw me present at OPAT this year, because this is a very similar talk to the one I gave at OPAT. So if you want to go get coffee, you've already seen me do this, but we know that harm reduction is facing threats today. It is scary times to be doing this work. It takes a lot of bravery. And I really was asked to kind of come in and just talk a bit about the history of harm reduction and kind of some of the things that I am thinking about in terms of how we keep moving this work forward, even though things are hard, to put it mildly. So I like to start off these talks by really reminding folks where harm reduction comes from. So, the term harm reduction was coined in the late 80s, and really it was a bunch of people who use drugs realizing that people were dying of AIDS and ain't no one paying attention to it. No one was talking about it. No one was doing anything. I am young enough to remember hearing from my elders and my teachers and my mentors what it was like to survive the AIDS crisis. But I also came into this work in a time when we were treating people, where our goal was to get people tested and get people treated. That said, in New York City, when I started slinging needles in 2002, about 50% of people who injected drugs were testing positive for HIV. And so it really was drug users taking care of each other that is where this work has come from. It took a long time for public health to get on board. It took even longer for behavioral health to get on board. And there are plenty of places in this country where behavioral health and addiction care are still opposed to harm reduction. So, I want to honor the brave warriors and the brave people living with AIDS, sex workers, drug users, who really are how we got here. And I'm afraid to say that I really think that that is the direction we're moving back to, where we really are going to need a lot of really brave people doing the right thing, even though it is scary. And we know it's right. We have data that it's right much more now than we had in the 90s and early 2000s. But data doesn't seem to matter to some of these folks at this point. So I also like to call out that the opposition to harm reduction work has always been there. If you came into this work in the last 5, 6, 7 years, it was much more highly acceptable and accepted as a practice than it has been 10 years, 15 years prior. These are just some early newspaper clippings about when Outside In went to open our syringe exchange program here in Portland. We opened in '89. We're the second oldest running harm reduction program in the country. And the pushback was fierce and it was national. And even at that time, right, this letter is framed on my wall in my office to remind me how far we have come. This is a letter from the state of Oregon saying that they would never support syringe access. That is not evidence based, that they would never support it and they would never use state funding to fund this kind of work. Um, we're not going back, we're not going to go all the way back there. I honestly don't think that, but I think like it's important to remember where we came from so we know how to move forward. In terms of today's challenges, I think we can't talk about this work without talking about the executive orders that were issued in July of this year to address homelessness, in quotes, and lawlessness on our streets. That explicitly names harm reduction as something that should be investigated and funded. It called for the Attorney General to look into ways that people doing harm reduction work may be breaking the law, and directed federal agencies to make sure that no funds were spent on harm reduction. This denial of funding is what actually has me most scared across the state, as it can really force people who don't want to comply to have to comply with some of these ruling, and depending on how agencies play this out. For example, it encourages the Department of Transportation to deny funds to places that don't comply with these orders. That is how actually they were able to, on the good side, get all emergency departments to have to treat people, was the threat of denying transportation funds. It's also how they got the drinking age across this country to be 21, was they just were like, well, we're not going to pay for your highways if you don't comply with our laws. So like these kind of threats are very, very real and something we cannot pay attention to and think about. Shortly after that, SAMHSA did release a document. It's a Dear Colleague letter. There's links on these slides to all of these documents. The letter itself, actually, although appalling in terms of how they talk about the work we do, wasn't actually not as terrible as I thought it was going to be, if I'm being completely honest. I find it hilarious that they created a distinction that said naloxone and opiate overdose reversal medications are no longer considered harm reduction interventions. They are OORMs, whereas everything else is harm reduction. So if you're just providing naloxone fentanyl test strips, you're not actually doing harm reduction work, according to SAMHSA. I disagree with that, but okay. It also really clarified how SAMHSA fundings can be spent. The interesting thing here is it didn't change that much, to be honest. I think the only thing I really identified that was banned from being purchased under the letter was vitamin C. Everything else was already banned. We could never use those funds for things like syringes and smoking supplies. But you know, that is good news. But it's still, the way they're talking about harm reduction is quite scary. I will name that organizations are already being told by federal partners that if they do not comply with the executive orders, they will not get funding. HUD, the Housing and Urban Development, put out RFPs to pay for housing. They just pulled it back today because of a lawsuit, but that explicitly says that any organization that is doing harm reduction work can't receive HUD funding. So these things are actually coming into play right now. And how it plays out, how the state pushes back, how we backfill dollars is something that is really an unknown situation. I also think it's important to acknowledge that when money gets tight, harm reduction falls to the wayside. It is prioritized less. We are really seeing a lot of pushback, a lot of NIMBYism around this work. it's, you know, here in Portland, it's been more accepted. There's parts of the state where this never went away. So I want to acknowledge that, like, for many folks doing this work across the state, like they know how to operate under a world of NIMBYism. But I think in terms of like our increasing criminal penalties around drugs and drug use, I think our federal partner is really pushing a law and order, kill the cartels kind of narrative. Is it's going to have trickle down impacts in our communities as well. So enough of the scary stuff. So what can organizations do about it and what should we be thinking about? And I think for me, it really is about thinking about, like, I encourage organizations to think about what their threats are and what risks they are able and willing to take are, right? If you are an organization that doesn't receive any federal funds, you should be doing the most you possibly can to get the most controversial stuff into the hands of people who are using drugs, right? If you are completely funded by private donations through state dollars only, those kind of things, making sure that you are giving out as many syringes as you possibly can, as many smoking supplies, injection supplies, because there is a chance that some of the bigger nonprofits who have more federal funds are going to be in a harder place to be able to do that going forward. If you are an organization that can't take on that level of risk for whatever reason, then sticking to things like overdose prevention tools may be the decision that your organization has to make. Being really thoughtful about how we do this work. And also being thoughtful about how we define doing this work, right? So like we recently here at Outside In went through the last 3 years of invoices and separated out our program supplies, which are things like sharps containers and wound care supplies, from anything that was actually drug use related. And to make sure that we can clear, like, not that we use any federal funds for any of that, but if upon audit, I want to be able to easily say, this is how we're spending this money. Additionally, I'm moving into a world where we're talking a lot more about the health consequences of using. For a long time, I think in more recent days, we've talked a lot about the radical love that is harm reduction and the importance of bringing community and building up voices and building empowerment. I think while we're still obviously doing all of that work, that is not what I will be leading with any grants that I apply for. That is not what I will be leading with in the way we talk about the work we do. It really are like I'm really moving to going back to our straight up public health messaging, talking about how we prevent and connect to care folks with bacterial infections, STIs, going back to talking about how we link people to prevention of how our supplies prevents the spread of HIV, of hepatitis C, around our connection to medication to treat opiate use disorder, our work around overdose prevention. I really am talking about how these services are grounded in prevention as a priority. And it's hard and it's scary. And there is risk involved. But knowing our history and knowing where we came from and knowing and building on the shoulders of giants that we stood upon, because again, when people first started doing this work, our executive director here at Outside In had our yard set on fire. There were active protests around this work. I have gotten death threats. Detailed enough that I actually reached out to law enforcement about them. I've been doxxed several times for doing this work. And I want to name that, like, being brave doesn't mean that it's not scary and that it's not hard. And I honestly believe anyone who wants to do this work it's an act of bravery. It's an act of kindness. It's an act of resistance just to be having these conversations. And so I don't think there's anyone on this call or in this room who isn't brave to be doing this work. And I just want to end by, again, shouting out some of the heroes and mentors from the harm reduction movement and the work that we do, and really name that if not for the brave souls who came before us, we wouldn't be here. And as shitty as it is to have to be brave and hopefully help build up the next generation of badass harm reductionists, like it it's important. And if not for them, we wouldn't be doing what we do today. And that's it. Did I stay under the 15 minutes? I can't tell. Are we good?
That slide made me cry. How many of my friends are on that slide that are no longer here?
Yeah. If I had more time, I'd shout out each of them, but I don't.
They know who they are. And
Mm-hmm.
Yep. Thank you very much. So, yeah, Haven, can you stick around for a few minutes for question and answer afterwards?
What time does this session end?
Got one more session, so one more 15 minutes and then question and answer. Two.
Can I do questions and answers now? I'm sorry to say that, but I have a staff person leaving and I have to man the exchange.
Sure. Anybody got questions for Haven? Online or in the room?
You're one of those giants, Haven, so says Lori Cobbs, Montana.
It's true. Absolutely. Anybody else? Okay, Haven, you are good to go. Keep up the
Thank you.
work. Stay safe out there. Love you.
Thank you all. Have a wonderful rest of your meeting.
Thank you, Haven.